Now, from the News Channel 5 network, this is Medical Mondays.
Well, hello and welcome into Medical Monday. I'm Chuck Long, going to be here with you for the next hour. Looking really forward to the show this evening. We are going to be talking about common foot problems. We all have them. So many different ones to talk about, so many discussions that we can have on them. And as always, this is your forum. We love to hear from you. And the number that you call, as always, is 615-737-7587 here on Medical Monday. As we talk about common foot problems, we are talking with Dr. Cary Gannon. Great to see you, Dr. Gannon.
Hi, thanks for having me.
Oh, it's, and as we were talking before the show, I started just listing all the things that I've had to deal with. I mean, where there's plantar fasciitis, there's ingrown toenails, so many things.
Sure.
Kind of tell me, in general, what do you see the most common foot problems seem to be?
Right now, a lot of heel pain, plantar fasciitis, ingrown toenails, diabetes. We see diabetics all day, every day. Diabetic neuropathy, toenail fungus, warts, bunions, hammer toes. Right now, people are out mowing their yards. I've seen a lot of people amputate some toes, mowing their yards barefoot. So that's kind of what we see a lot of right now.
I see. And there are so many ways, though, that these can be prevented or that these can be treated, and that's what we want to talk about. Once again, that number is 737-7587. We want to hear from you. Maybe you have a particular problem. Maybe it's a friend or a family member. But all you have to do is give us a call, get in on the conversation. And the thing that I always like when we're having these conversations on air is the fact that you may be listening to someone else who has that problem and you're thinking, oh, I can relate to that, or someone else does. And this is some great advice that I can use to help those problems. And I was telling Dr. Gannon as we started the show, one of the things, and I had never had this until about 2 years ago, but I couldn't figure out where this pain was coming from on the bottom of my foot. And I work out every day, and I thought, have I done something, to the muscle or something?
Sure.
And then realized after talking with enough people that it was plantar fasciitis. So is that fairly common with people?
Plantar fasciitis is one of the most common problems with the foot. I see it daily. It seems that anyone can get this. Active people, inactive people, it doesn't really seem to matter. Plantar fasciitis is not a muscular problem. It's actually inflammation of a ligament that attaches to the heel bone. And it's kind of tricky because you might feel better a little bit, and then you step up on it again and it'll hurt you quickly, and then it feels better again. And people think, oh, this is going to get better. And over time it doesn't, and it builds and it gets much worse. So yes, we see it very frequently.
Well, and there are a number of ways that you can treat it or that you can help it. And like one of the things that I did is I had that tennis ball, and I would sit there watching television, and I'm just rolling, my foot on top of that tennis ball, and that really seemed to help. What are some other ways that you can help plantar fasciitis?
Well, tennis ball typically isn't curative. What we're always looking for is supporting the ligament more adequately with rigid-soled shoes, rigid inserts for your shoes. Stretching exercises are frequently very helpful. Then we talk about controlling the inflammatory process so that it doesn't recur. A lot of times we'll do that with oral anti-inflammatory medications. Injection therapy can be very helpful. Taping, immobilization, ice. Ice is very good for this. People try to heat it, and it actually creates more problems. So also icing.
And how long do you use the ice on
Usually about 20 minutes for every hour, and then you take it off, you can do it again.
Okay, so that's good to know. And, the thing that I was telling you, and I was glad because when I first came up with it, I thought, oh no, am I going to have to deal with this, for the rest of my life? But actually, it's gotten much better. I haven't had a problem with it in a while, so I was glad to know that. Now, we were also talking heel pain and plantar fasciitis, kind of all related there.
They're one and the same. I think it's kind of a garbage basket term that people use. Plantar fasciitis, heel pain, heel spur syndrome, heel spurs, all of those things people tend to use to describe the one thing, which is just plantar fasciitis. And the important thing about plantar fasciitis is there's no cure for it. What we do is we get you better, and then we teach you the way to maintain it so it doesn't keep coming back, so you're not continually suffering from it.
Well, and one of the other things that I realized that I was doing that summer was I was wearing those very, very flat flip-flops. So, and that's not a good thing to do.
No-no.
That's a no. What kind of shoes should you have?
The more rigid, the more firm the shoe, the better. Obviously, shoes that fit adequately. I see that a lot. People don't wear adequately sized shoes. But the more rigid, the more firm, and a shoe with a slight heel. The more flat the shoe, the more likely you are going to get plantar fasciitis.
Now, when you say fit adequately, is that to fit, exact, or should you get it a little larger? Should you leave the shoes tightly tied, loosely tied? What's the key there?
We really need to have a more large accommodating shoe. You should always have about a thumb's width at the end of the shoe to accommodate the various shapes of the bones and muscles of your foot. If they're on too tightly, you will create problems. You'll create nail damage, ingrown toenails, damage to the skin, plantar fasciitis. So really a larger, more accommodating shoe is better.
Now, another thing that I did, and it seemed to help, and as I looked for advice, and that's why I love the fact that we're doing the show this evening, is because this is your place where you can get some great advice, questions, comments. Again, we welcome those when you call in. But when I was exercising, they said stretch out kind of, where you're stretching your calf muscle and that sort of thing. And that seemed to help. So I did that on a daily basis, morning and night. Was that good?
Those are all things that can help you manage plantar fasciitis, the stretching, the icing, and the shoe gear. If you do those at home on a regular basis, hopefully you don't have to come see me quite so much. But if it occurs again, come in and see us, and we'll give you a little tune-up and get you back to managing it appropriately with the stretching.
Now, I also want to mention, when you say come in and see us, where can folks come in and see you?
So we're located in Franklin and Spring Hill. So we serve Nashville, Brentwood, and Franklin and Spring Hill, but our two prime locations are in Franklin and Spring Hill.
And you kind of split your time in between?
I do. I'm 50-50 at each location.
Okay, well, that is good to know. Right now, though, we are going to head to the phones. Carla's on the line with us. Carla, good evening. Do you have a question or a comment for Dr. Gannon?
I do. I have two short questions.
Sure.
The first one has to do with some pain in my toes and my left foot, and it's just kind of like on the tips of the bottoms of the toes. It's bearable. I've almost kind of gotten used to it, and I'm not diabetic. I have an appointment with my primary care, so we'll be able to examine it. Second is with regard to my nails. I've noticed as I've gotten older that they kind of disappear from the sides, if that makes any sense.
So nail changes over time, particularly as we age, are not uncommon. Frequently they'll change shape, they'll change color, they will become thicker. A lot of times, particularly if shoe gear has been too small, they will thicken and look dystrophic or damaged. And then also nail fungus. We see a lot of nail fungus, and what happens with that is a lot of times our immune system kind of becomes lazy as we age, and it will stop fighting off the fungus that is present on our bodies, and the fungus kind of gains an advantage underneath the toenail and can thicken. But nails that are pulling back a little bit and changing shape, that's fairly typical. Nails are constantly changing just like we are, so I'm not super concerned about that. I would say with the toe pain without diabetes, if it occurs worse in shoe gear, it may likely be more from a functional perspective, or the mechanics that you're wearing. Sometimes you can get a pinched nerve that will create the sensation changes in the toes, or even hammer toes or bent toes that are creating the pressure and pain, and all of those are easily treatable.
Okay, good to know. Carla, thanks for calling in this evening. We appreciate it. All right, we are going back to our lines right now. A lot of you calling in. That number is on your screen. 737-7587 is the number to call. Have any questions about common foot problems? A lot of us do deal with this, so get your calls in now. We're going to go back to the lines, though, as we said. Rosalie is on one. Good evening, Rosalie. Do you have a question or a comment for Dr. Gannon?
Yes, I have a foot problem. My right foot is larger than my left foot. And I think they did an ultrasound and found out that there was a problem with the leg muscles of the right leg being larger too. And seemed to be an infection, so I was prescribed an antibiotic, which did help with the redness a little bit.
So it's not uncommon to have feet that are asymmetrically sized. Most people that come in, their feet are two different sized, usually by a half size or a full size. What you're describing, though, sounds a little bit more like you may have had a mild infection that possibly caused what we would call cellulitis, maybe the redness and the swelling of the leg and the foot, which would have increased the size of your foot, particularly during that time. A lot of times when we have the swelling and the edema, we recommend compression socks. Actually, we recommend compression socks really for everyone. Just below the knee, it'll help keep that under control, hopefully keep some of that redness and cellulitis that you get. And again, with the shoe sizes, you probably need to size your shoes up for the larger foot.
Okay. All right. Well, Rosalie, we appreciate your call. We hope you have a good evening. So thanks for joining us. We are talking Medical Monday. We are talking on Medical Monday, common foot problems. We are going to take a break. Get your calls in, questions, comments. We do welcome those. There's your number right there on the screen. We'll take a break, and we're back after this. You're watching Medical Monday.
This week on Fishin' Affliction TV.
I ain't going now, big doggy. Oh, nice fish, big dog. Nice fish.
Join Team Fishin' Affliction for some fishing action on legendary Lake Okeechobee for day 2 of Fishin' the Big O.
All right. Well, it didn't take long, did it?
No.
Your Fish Affliction TV weekend begins Saturdays right here on News Channel 5 Plus, your home for
Fishing Affliction time for those who've got it bad.
Big news from Beverly Hills. Celebrity plastic surgeon Dr. Andrew Orton has discovered an anti-aging breakthrough called Fill and Freeze, and he's giving away 1 million bottles free.
Wow, I'm young again. I don't feel like an old lady. Lines are gone.
It definitely took 10 years off. If I went to a dermatologist here in the city, I would pay $400 for this.
I've spent nearly 30 years looking for an effective, instant breakthrough to reduce the appearance of wrinkles, and I finally found it with Derm Exclusives Fill and Freeze.
This instant wrinkle-removing miracle sells for $60, but get yours now for only $39.95, and we'll include a second tube free. Dr. Orton will even include these 3 anti-aging bonus treatments, a $200 value free. But you must call to order. Call 1-800-616-7629. That's 1-800-616-7629. Order now.
She stands in the face of evil and will not lose hope or faith. America, the land of freedom, is still the home of the brave. So raise the banner.
And welcome back into Medical Monday here with Dr. Cary Gannon. We are talking about common foot problems. As we started the show, and I've said this already a couple of times, I felt like I was getting a personal consultation with Dr. Gannon because I think so many people can relate to so many of these problems that we've been talking about. We've been talking about, just to name a few, heel pain, plantar fasciitis, ingrown toenails, bunions, hammer toes, foot and toenail fungus. Diabetes is one of the #1 causes of amputations we were talking about a little bit earlier. We're also going to talk about ways that you can help these situations, certain ways that you can prevent them from time to time, but we want your calls. So this is your forum. There's a number on your screen, 615-737-7587 is the number to call. Now, one of the things that we were talking about as we went into the break, we were talking about plantar fasciitis, heel pain all being part of the same thing. One of the things that I noticed at the gym, people, once they go into the locker room and they're taking their showers and that sort of thing, is some are worried about making sure they have their flip-flops on in the shower. Some don't worry about that for fungus in there.
Sure.
How important is that?
I don't think that's the most important thing. I don't think you're going to catch a ton of stuff if you go into the shower at the gym without the flip-flops. Maybe some viral warts and stuff like that, but fungus, you're probably not really catching that from the gym. You know, humans, we are covered in fungus. Bacteria, mold, yeast, we're pretty gross. But we're covered in fungus, and basically we're carrying our own fungus with us everywhere we go. And when we have toenail fungus, 99% of the time it's because our own fungus has proliferated and gained an advantage underneath our toenails. So you're not truly catching toenail fungus when you go to the gym and don't wear your shower shoes.
Okay, well, that is good to know as well. We do have a lot of folks on the line with us right now. We're going right back to the lines. Mike is on the phone with us. Mike, good evening. Do you have a question or a comment for Dr. Gannon? Are you with us, Mike? Can you hear me, Mike? All right, we are going to check that connection, and we will get back hopefully very soon with Mike. Now, another thing that I was talking about, too, or asking you about regarding toenail fungus is how do you catch toenail fungus?
Sure. like I said, you don't really catch toenail fungus. You actually already have the fungus on your body, and what will happen is the fungus will gain an advantage on the toenail, and when it does that, it's a perfect environment for the fungus to proliferate. It is a dark, damp environment. It's sort of furthest away from our central supply, so it's the last thing that our immune system focuses on, and it will gain an advantage and proliferate underneath the nail. It's very, very hard and very challenging to eradicate completely because it's part of being human. We're supposed to have it. There are multiple treatments for it, though. Do you want to talk about those right now?
Sure, absolutely.
So the three main treatments of toenail fungus are going to be topical, oral therapy, and laser therapy. Topical is kind of the least effective, but most people like to do the topical because it's something that they can do. You have to apply it every day for 9 to 12 months, and you have to wait 9 to 12 months as the nails grow in to see if they grow in clear or not. And then you need to maintain it by continuing to apply maybe every week. It's about a 20% success rate. It's not very high. The oral medication has an excellent success rate. About 85% of the time we treat it with oral medication, it does get better. Again, you have to wait 9 to 12 months as the nail grows in to see if it will grow in healthy or not. Laser therapy is also very effective, not quite as effective as the oral medication. The oral medication comes with some potential risks with liver function, so we like to test liver function to make certain it's healthy. The laser, you'd get a monthly treatment with the laser, and again, you have to wait 9 to 12 months as the nail grows in to see if it grows in healthy or not. A couple of things, nail damage can look just like nail fungus, and so I'll have people come in who have been on oral medication for 3 years and their toenail fungus won't get any better. The reason for that is they've never had toenail fungus to begin with, and we'll do a nail biopsy, take a sample of the nail, and it'll come back as nail damage. And at that point we know, you know what, it's not even worth your time or your money to treat this as fungus. So it's important always to make certain that it's true nail fungus even before you treat it. Otherwise you'll waste a lot of time and resources to treat something that could be nail damage from shoe gear.
Well, and that's why it's important that they come in to see you. We were talking too during the break. University Foot and Ankle is where they can find you. And it's important that they come in for that. Do they have consultation? Is it good to just set up the appointment to come in and see you and check out what might be wrong?
So I usually initiate treatment the first day. I don't like to have you do a consultation and then come back again. A lot of times we can initiate treatment right then and there and go ahead and get the ball rolling to get you better.
Now, when you were talking too about some of the treatments and that sort of thing, what about, we talked a little bit going into the break, hammer toe. So what are some of the treatments for that, and what is hammer toe?
So a hammer toe is typically where the digits start to contract or become bent. Frequently that's from a muscular imbalance where the large muscles of the leg overpower the smaller muscles of the foot. The treatment for that, there's multiple conservative measures, inserts, orthotics, some bracing will help straighten the toes out, shoe changes of course, but none of those are curative. The only cure for hammer toes is surgical, and we do surgery on them quite frequently for people that are prepared to do that. Otherwise, conservative management can make you feel better, can slow the progression of the hammer toe, but it doesn't take it away completely without surgery.
Okay, and then back to even kind of talking about a timeline, when you're talking about oral medications, even when we talk about fungus and that sort of thing, how long are you on the medication normally?
For the oral medication for toenail fungus, you'll take one tablet a day for 3 months. That's for the primary oral medication we use. There are others that are used a little bit differently, but it's one tablet a day for 3 months, and then again, you have to wait for 9 to 12 months as the nail grows in to see if you have the results or not. The reason for that is the medication doesn't cure the fungus immediately. What it does is it clears the nail as the nail is growing in, and unfortunately our toenails take about a year to grow back.
Okay. Well, if you're out watching this evening and you're thinking you have something that is painful when you walk, it's painful when you work out, as I was telling Dr. Gannon when we started the show, I had this about 2 years ago, and I realized that I had plantar fasciitis. And one of the best things that I did was I sought medical help, and I found ways to make it more manageable. So let's talk a little bit about, because I know it's very, very common for people to have plantar fasciitis. So what are some of the ways that you can make it manageable, keep it manageable?
Again, that's with the stretching, the icing, the inserts, the shoes. Anti-inflammatory medication when you need it. A lot of mistakes people make will be to heat it, or they'll wear really soft, flexible shoes, and that just makes it even worse. There's a trend now with these low-profile, minimalist shoes without a lot of support. I love them because I get a lot of patients from them, but they're really not good for most people's feet, and they're a large contributor to plantar fasciitis. So I'd say shoe gear is probably the most important.
So when you're going into the sporting goods store to find that perfect pair of shoes, what should you be looking for?
So I don't think that there's one brand of shoe that is for everyone. Not every brand works for every person. Typically the shoe that's best for you is the one that fits appropriately, that is relatively rigid, and has a little bit of a heel. So for example, for a workout shoe, I prefer a true running shoe versus a really flat court shoe or some of these lifting shoes. I know a lot of the people that do a lot of heavy weightlifting or CrossFit like the flat, low profile, very flexible shoe because they're taught that they can retrain the muscles of their feet. It doesn't really work that way. Although they teach that, and a lot of times I'll see people that have been wearing those shoes and all we do is switch their shoe gear and they can continue that activity but with the proper shoe gear for their foot, eliminating that sort of flexible flat shoe that's sort of the trend right now.
And the running shoe has more support. It has more of an arch to
it. Depends on the running shoe, but typically yes. And again, you're looking for a shoe that is more rigid and a little bit of a heel, and that's typically your running shoe. Now, that's not all brands of shoe. If you can take a shoe and really bend it, then it's too flexible and probably not supportive enough for you. If it's difficult or challenging to bend with your hands, it's got a lot more support.
Okay, and what about the size in the shoe? Should you, if you're an 8.5, do you buy the 8.5 or do you go a size larger?
It depends on what you mean by 8.5, right? A lot of times we go to the shoe store now and they just throw a shoe at us, whatever size we say we are. Most of us haven't measured our feet since high school or even before that, and we've been saying we're this size shoe for a very long time. People are always surprised when they come to my office and I measure their feet, and typically their shoes are about 2 sizes too small for them. You should when you're measuring for your shoes, you have the branding device if you can find it.
Right.
You stand on it, bear full weight, have your feet side by side. The longest toe, you always want to put your thumb down and measure the distance after the longest toe, and where your thumb ends, that's the shoe size that you are, not where your toe ends on the device.
Oh, see, good to know.
That measures for the outside of the shoe. You want your foot to fit inside the shoe.
Right. Now, anytime you go in to get shoes, should you always get measured?
You should.
Every time?
You should get measured every time you buy shoes. Over time, our feet change in shape and size. Our feet are actually larger at the end of the day than they are at the beginning of the day. So the shoe that might have fit you nicely at the beginning of the day is likely too small for you by the end of the day because our feet naturally swell just a little bit. So the shoe should be more loose fitting at the beginning of the day, and you should have your feet measured at the end of the day properly for shoes.
Okay. Now, another thing, we see these advertised a lot, but some of the stores that are devoted to, those kind of comfortable shoes, comfort shoes, good feet shoes, that sort of thing. Are those good to go for these kinds of problems?
In some situations, I would say yes. I would also say that there is a lot of overcharge, or what I would say, charging a lot of for something that you can get elsewhere for something for not as expensive. I'm not disparaging them. A lot of times these stores do the best job measuring people, and they have the best quality products. But I've had patients go in and spend $900 on a series of inserts that they probably could have done for much less expense.
Okay.
And so for me, that's a little bit frustrating because you can get people better a lot more quickly without spending quite so much money.
All right, we're going to talk about inserts, but we do have to take a break right now. You are watching Medical Monday. We are talking about common foot problems. We want to hear from you. If you have questions, comments, just give us a call. You can see the number right there on your screen, 615-737-7587. We'll take a break, and Medical Monday will continue right after this.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
What a spectacular day across Middle Tennessee and Kentucky. Sunshine, blue skies, gentle breeze, really comfortable conditions. This will be the theme for the most part for the beginning of this work week. The only big change will be the heat. Significant warm up Tuesday into Wednesday. So overnight tonight, we may see a brief stray shower or storm in northern parts of the plateau, but everyone else will be dry and calm. Mild too, temperature wise. 59 overnight tonight, and this is where we're starting at. Lots of warmth across the southeast. Tomorrow, even warmer than Monday. 86 degrees for your top temperature. Now here's a look at current conditions in Nashville. Overnight tonight, we will drop down to 59 degrees, so very mild conditions. Typically this time of year, we're right around 55, so just a touch above average. 86 degrees for Tuesday, same thing for Wednesday, and then your rain chances will come courtesy of a cold front Thursday into Friday.
My car's here. I'll be home tonight.
God, I wish he was still here.
Grief is normal after a loved one dies, but almost 1 in 10 people will get complicated grief. A grief that causes people to withdraw from life. It often strikes those who have lost a spouse they were unusually dependent upon or lost someone to an unexpected death. Now, these effects can also include substance abuse, isolation, physical illnesses. Fortunately, we have effective treatments.
If you know someone who may have complicated grief, it's best to get treatment from a clinical psychologist or social worker. Treatment is covered by Medicare, Medicaid, and most insurances.
And we are back on Medical Monday. We are talking about common foot problems. A lot of you have them, myself included. I think it just is kind of the way of the world. We're talking with Dr. Cary Gannon from University Foot and Ankle. One of the things as we went into the break that we were talking about, the inserts that you use for the shoes, and there's so many out there in the marketplace. It's almost sometimes overwhelming. It is, yeah. So where do you begin? How do you choose?
Again, fit. Fit is very important. If it doesn't fit, it's not going to do what the job it's supposed to do. I find that people tend to buy inserts that are very, very soft. That's the opposite of what we're supposed to do. We need to buy inserts that are far more rigid, again, that don't bend. You kind of think about your feet as the foundation of your home. The bottoms of your feet, that little tiny surface area, supports everything above it. So if they're on something really soft, the bones and muscles of the foot have to work that much harder to support your body. Just like the foundation of your home, you build it on cinder block because it needs to be rigid to support the top of your house. So we want to, when we're looking for inserts, we want them a little more rigid and firm. It's okay for them to have a soft top coat, but when you evaluate them, you want to try to bend them. And if they're nice and firm and you can't bend them, that's the better insert for you. I would tell you though, if you do purchase a more rigid insert, don't wear it all day the first day. If you wear it all day the first day, your feet will be very, very sore, and you will not like the advice I'm giving you on the show. You want to wear them about an hour the first day, 2 hours the next day, 3 hours the following day, and slowly build up so you can wear them all day for your normal activities. Once you can wear them for your normal activities, then you can start to exercise in them. The other thing about the inserts is they're going to take up some space in your shoe. You might need a larger shoe. So you want to remove the inserts that come with your shoes and put the more rigid, firm inserts in, and make sure the shoe still fits you appropriately.
And where do you find the inserts? Where are the best places to go?
Sure. I mean, we obviously have a brand that we like at our office, and we use that frequently. You can get custom-made inserts as well. I find that there's not one brand that works well for everyone. Again, I believe the Good Feet store sells some nice rigid inserts. New Balance stores, they have a great insert. They do a really good job. I'm not a huge fan of some of the ones that you can get at Walmart, Walgreens. They tend to be too soft.
Yeah.
They're just not supportive enough, and people spend a lot of money on them. I personally prefer not to spend as much money on those things if you don't have to, and you really don't have to.
What would you say kind of an average price range?
I would say anywhere from $30 to $50 for an over-the-counter insert. You know, we sell a brand in our office called Power Steps. I run in those. That's what I wear. I could have probably custom inserts for free, and I still would gravitate toward the Power Step insert. So that would be one recommendation that I really stand by. Okay, good to know. Love the advice. Again, if you have questions, comments, you're just wondering, you've got that pain in your foot, you've got that pain in your heel, maybe it's a toenail, maybe something that's just been bothering you for some time, all you have to do is just give us a call. We're going to go to the lines right now. Mike is on the line with us. Good evening, Mike. Do you have a question or a comment for Dr. Gannon?
Yes, sir, I do. I'd like to ask Dr. Janet. I'm a diabetic, and before I come being a diabetic, I had surgery on both of my feet because when I was a kid, I started out, I had a bungee, and then I stepped on the Coke bottle, and all of a sudden these cysts started coming up with my foot. And Dr. Paul J. Summers in Nashville done surgery on my foot, and he cut me to the bone and cut all my tendons out and said it would never come back. And now it's coming up with little knots, and now on my left foot, I had to go have another surgery done with a Dr. LeMay, and he cut like 3 centimeters off my foot, bottom of it. And I just kind of want to know if it's something I'm eating causing these knots to keep coming. They say it's scar tissue, but to me, I would like to know if it is scar tissue from doing the surgery. Why do they recommend to do surgery? Is it common that you have on your feet? Because I do know that your feet is very tender, Sure. I can tell when I step on a baby rock or something like that, it's like, ow, And my other question I would like to ask Dr. Janet, and in time, once I get a building built in Nashville with the homeless and everything, does she ever treat any of the homeless? Could I bring them there if we have a medical insurance for them to be able to see them? Because I'll be honest with you, I've been doing it for 9 years, and a lot of them just don't wear socks and their feet swell up and they, get cut down on their campsites and stuff. And I don't know when that'll be, but I'd like to just ask her if she'd be willing to help me in any way, and I'll hang up in 3 times.
Well, okay, thank you so much for calling in. So, Dr. Gannon,
sure.
One of the things I know that he started talking about diabetics. That's also a risky thing. I know for a lot of folks with diabetes is they have certain situations where they're not even able to experience some of the nerves, the feelings. Sure. Yeah. So what's your advice there?
Well, diabetics get something called diabetic neuropathy, and it comes in 3 forms: autonomic, motor, and sensory neuropathy. Most people think of the sensory neuropathy because they can't feel their feet like a typical person can feel their feet. They perceive that they can, but they really can't. So they lose what's called the protective sensation in their feet, meaning they can step on a nail or a rock, or they can walk a hole through their foot and not even know it. So I'll see them come in and they'll be in crisis, and a lot of times we're able to help them, and other times it's too late and we end up having to amputate a part or all of the foot. And so for a diabetic patient, it is critical that they are vigilantly watching their feet daily, wearing the proper shoe size, wearing shoes with extra depth to protect their feet, checking in between their toes, checking in their shoes every single day. I get people who I have a guy right now who walked all the skin off of the top of both of his feet just because his shoes were too small. The bones were literally sticking out of the tips of his toes, and he'll be the first one to tell you, well, I can feel my feet just fine. You believe that you can, but the reality is that your brain isn't getting the signals the right way. So I would just say for the diabetics, it's critical. If there's anything going on with your feet, even if it doesn't seem like anything to you, I would rather see you and it be nothing than not see you and end up being a big deal and you being in the hospital.
Okay.
As far as Mike's questions, I can't really speak to what other doctors have done, because especially since I haven't seen you or had the opportunity to evaluate you. But a lot of times knots on the bottom of the feet occur naturally. We see those frequently. Sometimes it can be a ganglionic cyst. It can be something called a plantar fibroma, which is actually a thickening of the plantar fascia. And those, do require surgery to remove. A lot of times surgery on the bottom of the foot, as in anywhere in the body, can create scar tissue. The problem with the bottom of the foot is we walk on it. And yes, certain scars on the bottom of the foot can create increased pain. We tend to be very cautious about where we place incisions for surgical removal of anything on the bottom of the foot to prevent painful scarring. Without examining you, I couldn't say if it's scar tissue or the knots that you're describing, but surgically removing them is typically a good option.
Okay. Well, good to know. Now, as we were talking a little bit earlier, too, some of the areas that I know people have when you're thinking about the common foot problems, heel pains, plantar fasciitis, ingrown toenail. We were talking about bunions, hammer toes. Bunions. Now, that was something that I experienced a couple of years ago myself. Tell folks what a bunion basically is.
Sure. So a bunion is when the great toe starts to drift toward all the lesser toes, and the side of the toe or the foot sort of starts to stick out, and it creates this sort of unnatural or wonky shaped foot, and it creates a large knot on the side of the foot that gets compressed with shoe gear. A lot of times, people call it your grandmother's foot, but I find a lot of people have them, and it creates pain and pressure and deformity. It's challenging to get shoes that fit. It creates some functional inhibition, and unfortunately, that's a surgical problem. If the shoe changes and certain conservative measures don't work, it's a progressive problem that requires surgery to go away.
And basically, though, you can also help it, as I found out, just by getting shoes that are not so tight.
Absolutely.
Sometimes people, I think, you feel like you need the support, and you get shoes that are too tight and you tie them too tight, and it's the opposite.
Sure. We need loose, accommodating shoes so we're not compressing the structures of our foot. There's a large nerve that runs right over the side of the bunion that will be compressed in our shoe gear. The skin damage that occurs with it, and a lot of people will come in and say, I have to get my bunions fixed. I have to get my bunions fixed. We change their shoe gear and they feel a ton better, and they postpone or even prohibit surgery.
Okay, once again, great to know. We're going back to the lines right now. Sandra is on the line with us. Sandra, good evening, and do you have a question or a comment for Dr. Gannon?
Yes, sir, I do.
Okay.
Good afternoon.
Hi.
I was calling in regards, I had foot surgery by another podiatrist, and he took like 7 cysts off the bottom of my foot. He said I had a neuroma. He took the nerves out of the 3rd and 4th toe of my left foot, took a bunion off, and then also shortened my 2nd toe that I did not want him to. But my question is my 1st, 2nd, and 3rd toe does not go all the way down to the floor. And I was just wondering if she had any advice that I need to do. I mean, he didn't send me to PT. He did not give me any inserts for my shoes, so I'm just a little bit confused as to what I need to do.
So again, it's really challenging for me to make a good assessment or give advice based on not having seen someone, and I particularly can't speak as to what someone else might have done to the foot. It sounds like you had a hammer toe and bunion repair and possibly a neuroma removal. If they're sometimes they post-surgically they can be elevated, but usually that resolves. So it depends on how long it's been since your surgery. If they're still not contacting the ground, there are certain things that we can occasionally do to make that better. Inserts can certainly be helpful because that can bring the ground up to you. But sometimes, you know, it requires an additional procedure to kind of bring those toes back down. If it's not causing pain or dysfunction, I wouldn't do anything. I would just continue to maintain the appropriate shoe gear and comfort measures. But if it's causing pain and dysfunction, we can certainly take a look at it for you.
Okay, thank you so much for calling in this evening, Sandra. We're going right back to the lines right now, and Jim is on the line with us. Jim, good evening. And do you have a question or a comment for Dr. Gannon?
Yes, I do. I'd like to know if there's any certain shoe or insert that might help Morton's foot syndrome.
So Morton's foot syndrome is typically when the great toe joint becomes arthritic, and it's elongated or longer than other parts of the foot, and it creates jamming and pain. There are inserts for that. Some of the inserts are not tolerated well by a lot of my patients because they're so rigid. They're a metal shank and they're way too rigid. A lot of times just a nice rigid supportive shoe, because it prevents motion at that damaged joint, that if we can prevent some of that motion, it can feel better. So there are certain inserts. Typically that's a custom product though. That's not typically something that you can buy over the counter. So we can make something for you specifically for that problem. You know, occasionally we'll do injection therapy, anti-inflammatory therapy, but that can sometimes be remedied with surgery as well, depending on your level of pain and discomfort. There's also something called a Morton's neuroma, and I'm not certain based on our conversation here if that's what you're referring to, but that's just a pinched nerve in between two metatarsal heads, and that's something that we can also address with inserts again, injection therapy, occasionally surgery on that. I don't love doing surgery on those. That's not always the best outcome, but there's a Morton's neuroma as well, which is just a pinched nerve in the foot.
Would you just advise people, if they are having that kind of situation, to basically come in and see you so that you can assess?
Oh, sure. Right. It's very challenging to make any kind of true assessment over the phone or on TV. And you know, usually X-rays are required, and at minimum a physical exam, and that would be more helpful.
And how can they get in touch with you?
We are at 615-790-3323, universityfootlandankle.com. It's Dr. Cary Gannon and Dr. Jeff Poole.
Okay, so both of you are there, so that's good to know as well.
We have two. We have full coverage at both offices at all times.
Okay. Well, Jim, thank you so much for calling in this evening. Now, a little bit of what we were talking about, too, we touched on ingrown toenails. When someone, I mean, how can they prevent that? Is it the way you clip your toenails? Can that help with it?
So that's an interesting question. You know, I actually get that question pretty much every day in clinic. There's no perfect way for every single person to cut their toenails. You know, some people, yes, it's better to cut straight across. Others, it's better to go down in the corners. You know, some do the V. I find that kind of, if you're going to get ingrown toenails, you're going to get them. A lot of times it's due to the shape of the bone underneath the nail, shoe pressure, activity related, you know, other compression from other digits. If you pick at them, it tends to introduce bacteria into the periungual, the skin there, and it can create a worsening ingrown toenail or infection. There is no perfect way to cut your toenail to prevent them. Typically straight across is better though.
Okay. I also want to ask you, as long as you're here, I've been asking for a lot of advice this evening. What about the pet eggs and that sort of thing? Now this is just, you know, as far as when you just want to slough off that dead skin around the heels and that sort of thing. Are those good?
Those are good. Pet eggs can be a little bit aggressive for certain people because they're metal. A pumice stone, have you ever just used a natural pumice rock? Those work very, very well as well. If you do it daily when you're in the shower, it really helps keep the hyperkeratotic or thick skin under control. Calluses can be very painful on the bottom of the foot and the heels. The reason for that is, you know, the skin builds up for your body to try to protect itself from something sharp. But what happens is that skin becomes hard and you're walking on it, and the ground is literally driving that hard skin into the soft tissue of your foot, and it feels like you're walking on a rock. They're very, very painful. So a pet egg or a pumice stone with daily use can keep them under control. There's no cure for calluses, but if you come in, we can cut them out for you. They grow back, but we can cut them out really deeply for you.
Okay, once again, great to know. All right, we're going back to the lines right now. Brian is on the line with us. Brian, good evening, and do you have a question or a comment for Dr. Gannon?
No
comment, the sandstone, you know, from Florida, my lady friend and I, we go to Daytona Orm Beach twice a year. Sandstone on my heel and my big toe, I noticed. I go, what's up with that? And she goes, well, you check it out. So, you know, you get a little bit of that, you know, I guess they call it a bunion or something, but she uses sandstone. And then, I think, not a vitamin E, it's like I don't know the name of it. It's a lotion. I use it. It's kind of like a suntanning lotion. But the big toes and inside the left big toe seems a big problem with males. And so I use that. And I think that's about it.
Okay, well, great. Thank you, Brian. So how does, as far as, are there certain lotions out there that do have these vitamins in them that you recommend, or is it just good to keep your feet moisturized? I mean, things like that?
Sure. So hydration of the foot, you really should, because you can develop the cracking and then it leads to wounds and other problems, particularly for your diabetic patients. What I would tell you is that any lotion or cream is fine. Never ever put lotion or cream between the toes. If you put it in between the toes, it creates moisture and the toes squeeze together and you can cause skin injury. And I see a lot of infections when people put lotion or cream in between the toes. So there's really no brand that's perfect for everyone. Just don't put it in between the toes. Antifungal or foot powder between the toes is best. Apply daily, but otherwise, you know, there's no perfect brand.
Okay. If I was watching at home right now, this is one of those shows that I would be taking so many notes on. You are giving such great advice.
Thank you.
Yeah, you absolutely
Hopefully
are.
it's helpful.
It very much is. So I'd never thought about not putting it in between the toes, but great advice right there. We're talking about foot problems, and I know a lot of us have them. We are going to take a break. You're watching Medical Monday, and when you return, we'll take more of your calls and your comments. So come on back with us.
There's no single answer to securing your financial future. You need to look at it from every side. Get dependable advice you can count on every week with the Retirement Report on News Channel 5 Plus. Experts on finance, taxes, and the legal system are ready to answer your questions. Don't wait to make a plan for your money. The Retirement Report, Friday mornings at 8 and at these encore times on News Channel 5 Plus.
If you want to shed the fat and sculpt your core to get those sexy toned abs of your dreams, then stop doing sit-ups. Say what? And start dancing with Hip Hop Abs, the fun new ab sculpting system from Insanity creator Sean T.
I don't want you to ever get down on the floor to do crunches again. I'm going to break it down so you burn the fat and sculpt those abs fast.
Just do Sean's easy-to-follow moves to work your upper abs, middle abs, lower abs, and obliques, all while you're dancing.
I went from a size 18 to a size 2. I have abs now. I've got a six-pack.
And now the complete $80 Hip Hop Abs system is 75% off. That's right, Hip Hop Abs is only $19.95. We'll even upgrade you to express shipping free. Get the complete Hip Hop Abs system for only $19.95.
Call 1-800-339-1045 or order online at gethiphopabs.com. That's 1-800-339-1045. Call now.
Medical cures on the internet. Could they be dangerous to your health? Next in Inside Edition. Can an onion in your sock really stop the flu? Can toothpaste prevent acne?
You're going to want to put it on your acne spot.
Does butter really heal a burn? Then, pen pals for more than 40 years. Seeing each other for the first time.
It's awesome. It's crazy.
Next in Inside Edition.
Tomorrow at 4:30 on News Channel 5. Tonight at 10, News Channel 5 investigates. If you're in the habit of being late for work, you'd get fired. So when News Channel 5 found a judge who was regularly hours late for court, we had to investigate.
Went in the courtroom, sat and waited. There was no judge.
So where's the judge? Our undercover cameras watched.
It's almost 11 o'clock. There's still no judge on the bench.
News Channel 5's Phil Williams investigates. Watch tonight on News Channel 5 at 10.
The experiences. The kind that take your breath away and remind you what it feels like to be alive. Catching a glimpse of life under the sea or on top of the world. Walking in the footsteps of soldiers, legends, and kings. It's a feeling, a connection that can only be made in Tennessee. Start planning at tnvacation.com.
And we are back on Medical Monday. I'm Chuck Long here with Dr. Cary Gannon. We are talking about foot problems. And as we've said all through the show, and you see this every day, people have a lot of foot problems. I mean, do you have, like, as far as the body, is it just because we use our feet so much? I mean,
well, I mean, if your feet hurt and you can't walk, you can't work, you can't work, you can't eat. So it really brings them in. And we buy the wrong shoes, we buy the wrong size shoes, and we're working really hard. You know, we're constantly on our feet. So
well, and there's so many things, and like I said, when I was getting ready for the show this evening, I just started thinking about, I was like, oh, I was looking at some of the topics. I'm like, oh, yep, I've had that. Oh, yep, I've had that. And I was thinking of all my friends. And, you know, when I first had plantar fasciitis, I can't tell you how many people, everybody was saying, oh, and then they were recommending what to do and that sort of thing. So let's just kind of start. If somebody just happens to be tuning in right now, plantar fasciitis, very, very common. So basically, what is it, what causes it, and how can you treat it?
The plantar fascial ligament is a very thick, strong ligament on the bottom of the foot. It originates right in the center of the heel bone where you feel the pain. Over time, it doesn't stretch like it used to, and it's not as supportive as it used to be. So instead of stretching every time you step down on it, it will sort of pull and rip and tear right at its weakest point, right where it originates on the heel bone. At first, you know, you'll take a few steps and it'll feel better, and it'll kind of trick you. You'll think, oh, I'm getting better, and then the next day it might be okay, and then the next day it might start again. But over time, that inflammatory process progresses, and it becomes all the time.
Right. So, but there are things that you can do to alleviate the pain, to help it, which I love. So we are going back to the lines right now, and by the way, if you do have a question or comment, we encourage you to make sure you get in line with us here on Medical Monday. There's the number on your screen, 615-737-7587. We go back to the lines right now. Thomas is on the line with us. Thomas, we're glad you're joining us here on Medical Monday. Do you have a question or a comment for Dr. Gannon?
Thank you. Yeah, I'd like to ask the doctor about a toenail.
Okay. Go ahead.
About 2 years ago, I mashed one of my big toes, and of course, the nail went dead. And can you hear me?
Yes, we can.
Okay. It turned black and everything, you know. It finally, about 6 months ago, it finally grew back out to normal, but it keeps rolling down and rolling back under it. And of course, that makes my toe sore.
Sure.
Will that ever stop doing that, or do you know?
Bad news, Thomas. It sounds like you might have damaged the nail bed. When you damage the nail bed, that's permanent in nature, and every time that nail grows, it's probably going to grow back thick and rolled under like you're describing. We can do what's called a debridement for you. We can cut it back, keep it thinned out so that you're more comfortable and not in pain. But unfortunately, when you have an injury like you're describing where the toenail has fallen off because of damage, the nail bed itself, which is the part of the toenail, the toe that forms the nail bed has been damaged, and it's probably always going to grow back like that. We can do things to keep you comfortable, but we won't ever be able to give you the same nail back.
Okay, well, again, good to know that. So, and I know that's tough. One of the things I think a lot of people think when they're feeling like they have some kind of problem with a foot, with a toenail, that area, you know, when you're walking, is what you're wearing, where you find the right shoes and that kind of thing, the right inserts. We were talking a little bit about that earlier. So what do you advise people to do when they come in and they say, you know, I'm having problems, my foot's sore? Is it arthritis? Is it, you know, what should I do about it?
Well, certainly after we evaluate, sometimes there's things that shoe gear changes won't help. But I will tell you, a lot of times just changing the shoe gear is really, really beneficial. A shoe that fits adequately, as we described earlier, is very, very important. There's a lot of great stores in this area that take a lot of time and will actually spend the time to measure you for the right shoe versus just sort of throwing shoes at you when you walk by. You know, New Balance in the area does a really good job. David Parker Shoes in Cool Springs Galleria, his store does a great job. Good Feet store, you know, people tend to do very well there as well.
Okay, and some of it too. I mean, I just wanted to go over some of these items as far as what you can do to kind of better, so that you're not in a situation where I go, oh, I've got this problem, I've got that problem. What about wearing shower shoes or flip-flops around public pool rooms and showers?
You're not going to be able to eradicate or protect yourself from all bacteria by doing that. It may be from a hygienic perspective or a cleanliness perspective. It's not a bad idea, but we are covered in bacteria. We're covered in yeast and mold and fungus, and if it's going to grow on us, it's probably from our own bacteria.
Okay. What about this one? Change your shoes and your socks often.
Yes. I find that people tend to wear the same shoe for years at a time, and our feet change in shape and size over time. Shoes denature over time and don't fit you adequately. So it's always a good idea to change them out.
And is there a particular way that you should keep your shoes clean? I mean, literally, I mean, some people say, well, just spray Lysol or something on your shoes, something like that starts killing some of the germs, bacteria that might be in your shoes.
You can do that. That's not necessarily curative either, because again, we are covered in the bacteria and all those microbes. You can cut it down by always wearing socks, wearing cotton socks or wool natural fiber socks. We do something called Shoe Shield, which is very similar to the Lysol that you can spray in the shoes, but that's not curative. It's not going to prevent you from getting fungus or all kinds of infection. It may just lower the count in your shoes.
Now, and that was one of my questions too about using the right footwear. The kind of socks that you get, there are certain socks, and you were saying like synthetic fiber. Are those some of the better materials that you can use?
Usually synthetic fibers, or all synthetic fiber socks, are not the best for you. It's usually more of a natural fiber sock, like your cotton or your wool. Obviously, there's going to be some synthetic in there, but the predominance of the natural fiber is far better for your foot.
Okay. Then we're talking about toenails, and I know a lot of people have had ingrown toenails and that sort of thing. What about trimming your toenails? What's your advice there?
Again, there's no perfect way to do it for everyone to prevent ingrown toenails. Straight across works for some people, down in the corners works for some people. What I will tell you about ingrown toenails is one of the #1 causes I see that cause it are shoes that are too small, and then people that pick at their ingrown toenails. Now, I'm a picker. If I had something on me, I would be picking it, so I'm not in any way
judging.
Right, I'm not judging. I'm be like, what is that? Let me do it.
Right.
But if you pick at it, you frequently cause little injury to the skin, and it will worsen the ingrown toenail. And the other thing is no hydrogen peroxide. Hydrogen peroxide is terrible for skin, okay? It does not bubble out infection. It actually starts to damage some of the tissue, will make it more red and drain more. So when you're dealing with an ingrown toenail, Epsom salt soaks are better, betadine is better, saline solution is better, no hydrogen peroxide.
Another great fact to know. What about foot powder? Should you use that?
I love foot powder. It helps control moisture. Moisture is the environment that helps the fungus and yeast and mold and bacteria grow. So if we can keep the moisture under better control, we'll certainly help ourselves in that regard. So if daily foot powder in between the toes or in the shoes, I mean, even baby powder is fine.
And then what about the utensils that you use to trim your toenails or that sort of thing? You know, some you get the clippers, some you have the cuticle clippers, that sort of thing. Kind of, and should you keep those? I would think it's common sense, but keep those clean kind of thing.
You do want to keep them clean. The biggest problem that I see with those devices that you can buy over the counter are are not accommodating to the larger, thicker toenail. They simply will not cut through them and can't get around them. And I will have people come in, they're trying, plant pruners, garden shears just to get around their toenails. Don't do it. Come see us. We can take care of the toenails for you when they get that thick, because a lot of times those little nail trippers and stuff, they just aren't going to work for you.
I'm so glad to hear that, because I mean, people think, I've got to do this. Sure. But yeah, just go see you. What about the nail polish that some people just insist upon using? Is it good? Does it keep your toenails stronger? I know obviously it makes them look pretty, but
sure. Nail polish is kind of a mixed bag. It's not possible to make nail polish completely chemical free. It's not possible to live life without chemistry, but nail polish in particular, there are some polishes that are better for you than others. Nail polish with formaldehyde resin, camphor, DBT, toluene, TPHP, all of those things are very damaging, not only to the health of the nail, but also to the body systemically. Gel nails are very bad for the nail. Acrylic nails are very bad for the nails. We like everyone to always use a base coat. The base coat for the nail polish is not a shiny coat. It is something that adheres to the nail on one side, it adheres to the nail polish on the other side. A couple of coats of some healthier nail lacquer. Usually you're looking for a 5-free or an 8-free product. And then a top coat will really help kind of seal the nail in. But any nail polish that eliminates a lot of those chemicals is healthy for you. There's not any nail polish that is 100% curative or 100% chemical free. It just doesn't work that way.
Okay, very good to know. We're going to take a break. When we come back, we're going to tell you how you can get in touch with Dr. Cary Gannon, so come on back with us.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
What a spectacular day across Middle Tennessee and Kentucky. Sunshine, blue skies, gentle breeze, really comfortable conditions. This will be the theme for the most part for the beginning of this work week. The only big change will be the heat. Significant warm up Tuesday into Wednesday. So overnight tonight, we may see a brief stray shower or storm in northern parts of the plateau, but everyone else will be dry and calm. Mild too, temperature wise. 59 overnight tonight, and this is where we're starting at. Lots of warmth across the southeast. Tomorrow, even warmer than Monday. 86 degrees for your top temperature. Now here's a look at current conditions in Nashville. Overnight tonight, we will drop down to 59 degrees, so very mild conditions. Typically this time of year, we're right around 55, so just a touch above average. 86 degrees for Tuesday, same thing for Wednesday, and then your rain chances will come courtesy of a cold front Thursday into Friday.
This week on Fishin' Affliction TV.
I ain't going now, big doggy. Holy, nice fish, big dog, nice fish.
Join Team Fishin' Affliction for some fishing action on legendary Lake Okeechobee for day 2 of Fishin' the Big O.
All right. Boy, it didn't take long, did it? No.
Your Fishin' Affliction TV weekend begins Saturdays right here on News Channel 5 Plus, your home for
Fishin' Affliction time for those who've got it bad.
Wow. That is literally 6 feet.
Stay cool this summer.
You don't have to turn on the stove. You don't even have to turn on the grill.
With Clinton Kelly's 3-course, no-cook feast. Done! Then, it's bathing suit season. Have no fear. We've got a swimsuit supermodel here, Ashley Graham.
We had to take her and show off that sexy body. Hello.
Plus, I'm getting corny with pasta night. Next, Rachel.
Tomorrow morning at 9 on News Channel 5.
And we are back on Medical Monday. We appreciate all the calls and comments we've had throughout the hour. We've been talking about something that is very common for a lot of folks watching, common foot problems. Now, we've been talking with Dr. Cary Gannon, and we do want to let you know how you can get a hold of Dr. Gannon. The information is right on your screen, coming up on your screen. You can get a hold of her by calling 615-986-6033. That's the Advanced Health Referral Line. And you can email appointment requests to medicalmondays@ouradvancedhealth.com. So, really appreciate it. Great advice, Dr. Gannon. This has just been like a learning experience for me, so I really appreciate it.
Thank you so much.
All right. All right. Well, that's all the time we have. Glad you were watching Medical Monday, and we'll see you next time. Have a good evening.